What comes to mind when you hear the word addiction? What kind of judgment or images come to mind? Addiction is a disease. According to the CDC, over 178,000 people died from excessive alcohol use in 2020 to 2021, which is 29% higher than 2017. In a 2022 study, the CDC also attributed deaths of 1,007,941 people due to drug overdose. 1/3 of people in the US know of someone who died of an overdose. The disease doesn't affect just the person with an addiction. It is heartbreaking for family and friends witnessing someone they love actively addicted to a chemical, substance, or activity. There are two types of addictions. 1. Substance addiction. This is when a person develops dependency on alcohol, drugs, prescription or illegal drugs, or nicotine. 2. Behavioral addiction. This includes gambling, internet or video gaming, shopping, or even eating. In some cultures, like the US, drinking is acceptable or even encouraged. Alcohol use can be a way to unwind at the end of the day, socializing with friends and family, or celebrating holidays or special occasions. Many people can easily choose to drink or not drink, and rarely drink too much because of how horrible it makes them feel physically and emotionally. The question is, why do people drink alcohol? It doesn't make sense because our nose, when we smell alcohol, tells our brain that it is fermented fruit or grain, and you probably shouldn't drink it. As usual, the brain is right. However, we drink and find it relaxing us, and maybe even helping us socialize more easily or to de-stress. And when we start associating these feelings with alcohol, or substances, or behavior, it becomes a habit. Other substances like certain foods or behaviors like gambling, sex, or shopping can also be used in similar ways. Holidays usually involve certain foods, and people give into cravings for chocolate or sweets when they are feeling distressed, or gamble as a social activity. All of these substances, activities, and behavior all activate the pleasure center in our brains that make us feel good. We all want to seek pleasure and avoid pain as human beings. It is a strong survival instinct. Addiction can shroud our better judgment, allowing little room for moderation. This response might get enhanced due to genetics, brain chemistry, or limited knowledge of adaptive or healthy ways to express emotions. It is a complex health condition, which requires specialized diagnosis and treatment. However, because of social stigma, people may try to hide this or stay in denial to avoid seeking help. You may be joining us today because you are concerned about your health or someone you love. It helps to talk with a professional or to take an assessment to determine if substance use, behaviors, or activities are unhealthy for you, or the amount of time is spent engaged with the substance or focused behavior. Have friends and family told you that they are concerned about you? Have you had problems or legal issues related to behaviors while drinking or using substances? Is it affecting your health, energy, or work? If you are concerned about a loved one, have they withdrawn or become irritated or annoyed when trying to talk with them about your concerns? This disease thrives on secrecy and keeping feelings and thoughts hidden. Recovery is possible and involves bringing things out. Like any disease, treatment is needed to help regain health and balance. There are resources available to get you out of this endless maze. For immediate relief, detoxification, behavioral therapy, support groups, and medications can help immensely. But it is essential that certain long-term changes are made too, like lifestyle management, continued therapy, and support groups. These tools equip an individual to battle addiction in a healthier way. There is hope and strength in asking for help. Today, you are taking your first step towards recovery. Keep watching other videos and connect with a qualified expert for more help.